The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to be speaking with Kimmy Everman, who's a program specialist all about Medicare. It's Medicare 101. We haven't done one in a while, and you're not going to want to miss it. We're also going to be talking about open enrollment. It's September now, and you've only got a little bit of time left to think about it. So I know you have questions. I know I have questions. So make sure you stay tuned to today's Aging Horizons.
Summer in Montana is a great time to visit your local farmers market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmers market.
"45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up, and I lost it all. I knew smoking was expensive, but I never thought it would cost me everything."
The human heart. Even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath, are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we're speaking with Kimmy Everman. Kimmy, thank you for joining us. Now, you are a program specialist with the state's Unit on Aging.
I am.
Okay, so let's just talk a little bit about Medicare. It's September now, and I know we've got something big coming up.
We do. But, I thought that today we should talk about, before we talked about open enrollment, just enrolling in Medicare, in general, because it doesn't just happen at open enrollment time. People's birthday is all around the year, and you want to make sure that you get every bit of that benefit. And I'll tell you what, one of the reasons I wanted to talk about this was, as I was researching, I reread something I forgot that I think is a great benefit about open enrollment or enrollment in Medicare. And so I thought we better talk about this. People don't remember everything.
Yeah.
It's a complicated process. So Medicare is that insurance you get when you turn 65, and you're going to get Part A, Part B. We'll talk about Part C and D as well, but you get a whole package of medical care at age 65.
Okay.
Some people get it earlier because they may be found disabled by Social Security criteria. They've gone through the process with Social Security. They also will get Medicare. And then also folks that have something called ESRD, which is end-stage renal disease.
Okay.
And that can be from a baby, which I had in my life a good friend with a baby that had renal disease, all the way to seniors. Okay. So Medicare is there from baby to the very, very last day.
Wonderful. So how does a person enroll or apply for Medicare?
Sure. Well, let's say you're going to enroll first, because that's kind of different than applying. Enrolling kind of, to me, says you've worked at least 10 years full time, and that translates to 40 work credits with Social Security. And most people can do that without even blinking. We all work so hard. You can work a couple years here and there. Moms especially love to know that when they took time off to raise a child, that doesn't count against them. They can come back into the workforce and still just be earning their points, if you will.
Wonderful.
And then it comes at 65, and although Social Security full retirement ages for money benefits has changed a bit for people, Medicare is still 65 years old.
Okay, so is it the day you turn 65 you have to run down to the office and enroll, or is there a grace period, a period around your 61st
Well,
birthday?
everybody knows who's ever seen me talk about this that I say do it early.
Sure.
And this is where that really great benefit comes in that I forgot all about. Normally what you're going to do is you have your 65th birthday month. You have 3 months prior to that, and then you have 3 months after. So a 7-month window to enroll. But you're probably working. You need to switch over and talk to everybody. So there's a lot to do. I always say go ahead and get it done in this window. Don't wait. And even if your birthday is the very last day of the month, you still get it your first birthday day of that month, as long as you have done your enrollment here. And here's the great benefit, and I know this because I'm a first of the month born baby. If you're born the first of the month, and I'm a December baby, so instead of November, September being my enrollment, I'm going to enroll in August, because then I can start November 1st.
That's
because
wonderful.
I have my birthday on the first day of a month. That is a great thing. Now think about it. If you've paid for health insurance while you've worked, you know that even a month of health insurance from some organization is a lot different price than Medicare.
Right.
So that there's so many great things about doing your enrollment and doing it well in advance.
Absolutely. So we want to make sure that you get in there 3 months before your birthday. Do that right
and
away.
what you can do is go online to the Social Security website. That's really, really easy way to start. If you have problems, however, contact your local office.
Okay. And you said some letter acronyms, the A, B, C, maybe L, M, N, O, P. I'm not even sure anymore. How does a person know what type of Medicare is best for them?
Well, it comes, there's A, which is hospitalization. There's B, which is outpatient. There's D, which goes for the prescription drugs. And then Part C is a kind of a Medicare that encompasses all those together. And that's called Medicare Advantage. So you can either have traditional model or Medicare Advantage model. You need to talk to a SHIP counselor to find out what the differences are so that you can make your own decision.
And how do I find a SHIP counselor?
Well, we're going to put that number up on the screen, I hope, because they are with your local area agency on aging, highly, highly trained in Medicare, very caring advocates, and also confidential, objective, and no cost. You've paid taxes for years and years. This is a benefit for you, especially as a senior, but anyone going on to Medicare. This is a benefit to help you figure out the best way for you to have your Medicare.
Absolutely. So Kimmy, I know that Medicare is an excellent value.
It is.
But there is some cost, and when we come back, I know that there are some programs that we can refer people to that are going to help them cover those costs. Is that correct?
Yep.
Wonderful.
We'll talk about it.
When we get back, we're going to talk about a little bit about those helping programs. And thank you so much for giving me another lesson on that alphabet soup that is Medicare.
Sure thing.
So make sure you stay tuned. You're not going to want to miss it.
I
think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid? And how do you decide if you need Medicare supplemental insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Welcome back to Aging Horizons. We're speaking with Kimmy Everman and we're doing another great Medicare 101. So Kimmy, before we broke, we talked all about the alphabet soup, A, B, C, and D.
Right.
So can we cover that one more time just for my benefit?
Yeah, well, and for everyone's, because don't feel bad. It's very easy to forget pieces and parts or what each does. Part A is your hospitalization. That comes to everyone that's got that 10 years of work under their belt at no premium. Okay. If you were going to pay that, if you have 29 months or less, you might have to pay in the range of $400 a month for that. It's still a pretty good deal. Yeah. If you've looked around, you'll know that. Sure. But let's stay with the fact that for most people, because they've worked so hard all their lives, they get that at no premium. Okay. So hospitalization, Part B, that's what comes with a premium. Part B is when you go to the doctor and you see him because you have a cold, you need a shot, whatever. One of the great parts of Part B is, even though that there's that deductible and there's the premium each month. One, as you mentioned, and that we'll get to, we do have helping programs for that. And two, you're getting a lot for it. Sure. And one of those things, or many of those things, are those preventive benefits that we've talked about so many times. And I'm not going to bore everyone and try to read through the list because luckily I didn't bring it. But however, it's a long list of great things. If you need that list, you can call your area agency and they can get it from me for you, or you can go online and take a look and just Google it up and see what's there. But you can get all kinds of preventive work done that everybody needs to have done. So that's under Part B. Part C, I'm going to skip over as I always do, but I'll come back. And Part D is your drug benefit. Luckily, it's there. We had nothing like this prior to between 2004 and 2006 when things started to roll. Folks, if they didn't have it, they didn't have it. And they were paying, flat money out of their pocket without insurance assistance for any medication they needed. So one thing that I know as a former SHIP counselor, we're happy as we can be that that's there because it's so important. Now let's go to Part C. Part C has a little bit of that, and a little bit of that, and a little bit of that. It has all the pieces into one place, and you get it from a private organization like Blue Cross or United, or I don't even know all the names, and I wouldn't want to say leave anybody off the list, but a private organization that brings those services together. They have rules and networks about it, but for lots of people it works really, really well.
Sure.
We call it a one-stop shop. That is Medicare Advantage. Medicare Traditional is anybody that'll take A, B, and D, go to them. And you are not going to be balance billed because that's against the law. They have to take what Medicare will pay. Same, in Medicare Advantage you might have extra copays you should find out about. But that's how that goes. And you know what? Come and see a ship counselor.
Absolutely.
Let's run the number, because that's where you're going to learn about how all these work. And as you said, we do have helping programs, and that's when you're going to find out among all these the costs there might be out of pocket and which of those programs might be right for you. We have one for the Part B, which is Medicare Savings Program. We have one for the Part D, which is the prescription drug coverage. And it also works with most of Part C. So there's no reason to look and to not look. And we always say, don't just decide you're not eligible.
Absolutely.
The very worst thing that can happen is they can say, no, sorry, we can't help you. But that isn't the worst thing that's ever happened to so many of our Montana citizens, right? They can do this and then end up having what we would hope to be several $100s left in their account at the during the month, so that they can do other things than worry about making ends meet.
Absolutely. So the Medicare Savings Program, that's your Part B helping program, and that's going to cover part of the premium and maybe part of the deductible. Is that correct?
Well, there's 3 levels. That means that you can make a different amount of money at 3 levels among that the Medicare Savings Program. And just quickly, I'm going to say the acronyms: QIMBY, SLIMBY, and QI. Many people have heard those. So it depends on where you fall in those categories, but like the QIMBY pays pretty much everything: the deductible, the co-pays, the premium, everything that might be out of pocket to you.
Sure.
And then there are different, as I said, at those levels, different sort of sliding scale fees, but you're still getting that assistance to help get that every month. So yes, that's Part B. Okay, and then Part D has got the low income subsidy. Lots of people have heard of it as extra help.
Okay.
And what it does is help pretty much in the same way. It pays for the plans, the Part D plans, up to a certain price each year, and it helps pay for co-pays or deductibles and things like that. In some cases, again, levels, so you can make different amounts and still might be eligible. And then you also are maybe going to get some very low prices at the counter, at
and
the pharmacy
couldn't
counter.
use that?
Oh my, yeah. I just spent $80 yesterday, and I tell you, it would have been nice, yeah. But we want people who have worked so hard to earn this to give those ship counselors a call. We want you to know that this is not a handout. It's a handout.
Absolutely. So Kimmy, we've got a big deadline coming up. So when we get back, we're going to talk all about open enrollment. It's coming up soon, and you're not going to want to miss those deadlines.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
This is Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
Gentlemen, this is a secure federal facility. Do you have your Montana Real IDs?
ID? I am Captain Lewis, and this is Captain Clark.
I'm sorry, I can't let you in.
Can't go into a federal facility, can't fly. Let's go back to the river.
Yes, we'll float home. Let me check the Google. What's a dam?
Discover more at mtrealid.gov.
Montana Real ID. It's the real me.
Welcome back to Aging Horizons. We're speaking with Kimmy Everman, and we're doing another great Medicare 101. So, Kimmy, this is September.
Yeah.
We're coming up on a huge deadline. What is it?
Yeah. Open enrollment.
Wonderful.
Open enrollment's coming. Starts October 7th and goes all the way through, October 15th, and goes all the way to December 7th. I have to always remind myself and remind those next generations, December 7th.
Okay. Okay.
Pearl Harbor Day.
What is open enrollment? What does that mean?
Well, open enrollment is a time for Medicare beneficiaries who don't have other, some have other rights in order to move around during the year. Not all. Some beneficiaries pretty much just get this time, October 15th through December 7th each year, to make decisions about changing if they want to. So that's what that really is. However, we always say change, but you know what? I've learned from my mom, she hasn't changed in years because she's real happy and because the company does fine. They give her good service, it doesn't cost too much, and she likes that stability. So what we're going to do is not only look at do you need to change, but also is it okay to just stay where you are?
What are some of the reasons that someone might want to change?
Well, let's say that you were trying to get a medication and it was much more expensive than you thought that you were supposed to pay, and you didn't get good customer service when you called to find out why. Or you were promised a bill in 1 month and it didn't come until many months later, and then they're chomping at the bit for you to pay.
Sure.
What it really comes down to is one, customer service, and also two, the medications on the formulary. We've talked about the formulary before. That's that big list of meds that your plan is going to cover. If it gets taken off of the formulary and it's something that you take, you're going to have to find out, well, if I stay with you, will you still provide it for me? And if so, how much? And that's called a special exception, and you have to make special requests for something like that. It can be done, it isn't that, but that might be one of the things that would happen.
Sure.
And so, or the whole thing might be too expensive. Maybe in the years since, you and your doctor have found a way to get you weaned off lots of medicine and you don't take so much anymore.
Right. Absolutely. What is one of the ways that someone decides, how do I pick the prescription drug plan I'm going to be on? How do I look at a different Medicare Advantage plan? How does someone do that?
Well, luckily what we have is called the Plan Finder.
Okay.
And this is where those great ship counselors come in, because they know how to use this database like no one else I've ever seen. And what it is a huge database with all of those plans from your state, as well as all of the Medicare Advantage plans from your state, and they can be compared side by side, so that if you sit down, and if you're able to do it, fantastic, because it's certainly open to the public. But if you can't and you sit down with a counselor, you can see right on the screen the expenses. There's always, do they have a deductible? What's the copay? So you see what the different things are here about the plans, and then you can look straight across and see. And at the bottom is always what it's going to cost you for an entire year. And a lot of times, Katie, this is amazing to me because I'm not so great at money, but lots of times those ones that look really cheap are much more expensive over the year time than something else. And one example is a deductible. And I've always said the plans without deductibles will sometimes get you later, and sometimes they do, and they may end up being much more expensive throughout the year as opposed to one that has a deductible up front. But again, it's all about what you and your financial means can handle.
So when you call to make this appointment with your SHIP counselor, what should you bring with you? What do you need to bring to that appointment to come prepared?
Well, for one thing, I hope you bring your Medicare and You book, because that comes in September. And no, I'm just joking. You don't have to bring that, although to prepare for that meeting, you should take a look through that. You can see the plans and such, if anything has changed throughout the year and gives you question. But to the meeting, you should bring your driver's license, you should bring any medication that you take, and it's lovely if you can get a list that's from a computer, either from the doctor or from the pharmacy. And you bring your Medicare card, which most everybody has a brand new one this year. And this is another time where if you don't, what a great time to check in with a SHIP counselor and say, I didn't get a new card and I don't know what to do, and they can help with that.
Absolutely.
But then, and you also come with an idea of, okay, where do I want to pick up my medication? Do I want to get mail order medication? Is that easier for me and less expensive? Just those kinds of questions. Be thinking about that. Medicare does have a really good sort of fact sheet that you can find on their website that talks about what you should be thinking about and to make these decisions. And the same applies, as I was saying earlier. If you don't want to change, apply those same sort of thoughts. What did it get expensive? Were they good customer service providers? Could I count on them? That sort of thing. Why change? And I do want to say, however, that if you do nothing, you will simply be rolled over. If your company that you're with this year has a similar plan or the same, you will simply be rolled over, and you have no right or benefit at that point in time to change, because you did nothing between October 15th and December 7th. You asked about deadlines. There are definitely deadlines. Now, one thing I will say is we've had many times over the years where natural disasters happened, hurricanes, etc., where Medicare did not enforce deadlines with people who were in disaster areas. So things happen. You might not be in a disaster area, but things happen. Rarely, but we take it case by case. But for the most part, yeah, you have that deadline.
Kimmy, thank you so much for being here today. Once again, call a SHIP counselor. It's the most important thing to take away from today. Call a SHIP counselor. Kimmy, thank you so much.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.